I'm Nate Frink. I am the Hospital Medicine Director.
I'm Abby Miller.
Will Nicholson.
Abba Harish.
Larry Lerbecki.
Sherry Moriarty.
I'm Krishna Papala.
Dwayne Cooley.
Greg Glover.
When I started looking out, I had to move to the Twin Cities and I looked at quite a few systems here. The thing that really stuck here was how comfortable people found themselves to be. They're very friendly. It was something that was not a put on. It was, you didn't have to put on a face. It was, I could sense that.
It's a really satisfying place to be. I've worked here, but I've also been able to teach at the university, do research, and do other types of undertakings. And it's really been fantastic. It's one of the best things I think about being a hospitalist.
You can look at, compensation, vacation, CME money, and all this. That's all good and fine, and they're all going to be very close. I think it's your work environment that you work in. That's the most important. You got to love to come to work, and this is a great place to. It's a great place to work.
We have full spectrum of specialists here, from neurosurgery, neurology, nephrology, cardiology, which are the HealthEast Heart Care group, and getting us a consult is very easy. One thing I found is really interesting here is they're all community-based specialists, and they want to see your patient, and will frequently come in even after hours to see your patient if you ask them to.
Everybody's really receptive. I frequently get phone calls right away from the subspecialists who want to call and consult and collaborate. So it's really great. There's a lot of mutual respect.
The census is reasonable. You're paid well. You are well taken care of. You get all the good benefits. You're geographically in a nice location. People from other geographic parts of the United States might ask us, oh, it's located in Minnesota. How can you even possibly go up there because it's so cold up there? Well, I think for me what matters most is more than warm places, it's warm people that matter to me, and that's what I found here, and that's what is going to make me stick around here for much longer.
I'd say the thing that really stood out the most was the culture. Again, having practiced at a lot of other places in the Minnesota area, there's something different here.
One of the most valuable things about working for HealthEast that I didn't realize until I started my career was that being at a place that is flexible enough to grow with you and to let you do the things that you're interested in. A place that can let your job sort of change as you change.
Administration is always looking out for us. They are always asking and making sure that we're happy, we have the services that we need, we have the computer systems that we need, so that it feels really good to know that they're looking out for us and for what we need and what our interests are. And from the nursing, that's one of the main reasons that I wanted to stay here at St. John's. The nurses here are terrific. They're good. They're very, very good at what they do. They're, again, like I said before, everybody here really loves their job, and it really comes out in patient care. They take excellent care of their patients. I don't know how many patients every day are telling me, everybody here is just so terrific. They take such good care of you here. So that, to me, that shows that we're doing something right.
HealthEast in general, and especially St. Joe's, does not just treat patients and treat disease, but also using spiritual care, using integrative medicine, a holistic approach. It's one of the only places where the spiritual staff are actually employed. They're not volunteer.
It's a faith-based organization, and it's a physician-friendly organization, and it's not your typical, probably real top-down, I think, organization. I think a lot of people really like that, where they can come to work and have a lot of input, and people find that they can impact processes and certainly impact patients' lives, and there's a lot of fulfillment that you get out of doing something like that.
Probably still to this day it matters the most is the spiritual background. It's how each person is connected, sort of a spirituality that connects everybody. It's a sense of commitment, and it's a sense of teamwork and a sense of responsibility. You feel that it's your job, and not only your job, but your purpose to help the patient and the families. I think that sort of pushes you to be helpful towards each other too, and not just make it hard for anyone to work here. So I think that is something that sets this system aside.
I've always been pleasantly surprised here at St. John's, although it's a community-based hospital, that we see such a variety of very interesting conditions, and we see some really rare things, and I think that's really good for a community-based program. I also like the fact that we have a residency service here with a family practice residency, and I think that brings in an interesting pool of patients as well. So I think it's a pretty well-rounded program for a smaller hospital.
The other thing I would say, one thing that might be, I think, is an important aspect is a physician engagement. We have our medical director is Doug Berg, who I think goes out of his way to really work with the group and to talk with us as far as some of the decisions that are going on.
We certainly encourage as much physician involvement in the committee work and the just daily functional work in the hospital as possible, because we believe that physicians are kind of key to figuring out better ways to care for patients, and so there is lots of opportunity for involvement in that way, and there's a lot of, I think, fulfillment that you get and satisfaction that you get out of that.
The thing that keeps the people that I think are great here is that we're totally as connected to the patient and the community around us as we possibly can be. That our work doesn't exist in some abstract land somewhere where we're just counting relative value units and DRGs, but everybody that I run into throughout the day is thinking about, how do I improve care for this patient? How do we improve outcomes for this community? How do we be more valuable and more effective? And that's what I trained for years and years to do, and it's nice to be able to focus on that. And I think a lot of other people in healthcare have that same feeling. I mean, we could have gone and done something that didn't include do no harm, but I feel like our organization is still very driven by that idea of first doing no harm.